Well, good evening, everyone. I am showing 5:30 p.m. and to honor your time, we will start on time. I'd like to introduce myself. First of all, my name is Maury Tarver. I'm the Director of Student Management and Operations for Nacogdoches ISD. And we want to welcome you and say thank you very, very much for joining the Student Health Advisory Council. This is a very important council for our district and is governed by many parts of the law when it comes to education and student health. And we really do appreciate you. I'm going to also introduce Ramone, Miss Ruby Ramone. She is our lead social worker, and she is our chairperson for the SHAC committee. And she does a great job. So if y'all have any questions, concerns, topics that you need to bring up in the future, you can email Ms. Ruby or myself, and we'll be certainly happy to answer any questions y'all have. So at this time, I'm going to turn it over to Ms. Ramone so we can begin the meeting.
Hi, welcome to all of you, and thank you very much for volunteering your time to help us out with the Student Health Advisory Council. It's 5:33, and I'd like to go ahead and call this meeting to order. Is there anybody who would like to be a note taker for the meeting? We will have notes up on our website, but if there's anyone who would like to volunteer to take notes, we would appreciate that. All right. So Lauren, you'll take notes?
Yeah, just give me like 1 minute to get.
All right, thank you.
Thank you, Lauren.
I'm good.
Thank you. Okay, so we have something called the Texas Open Meetings Act, which requires us to record all our Student Health Advisory Council meetings. So this meeting is being recorded, and it will be posted on our website. That is something that is now mandatory. We will also be posting our notes. That is also mandatory under the Texas Open Meetings Act. So I wanted to let you all know that. I know some of us don't like to be in the picture. And so if you feel like you don't want to be in the picture, you can just hide behind the screen. That would be okay. I wanted to talk a little bit about what the purpose of SHAC is. I want to let y'all know that each and every one of us was selected by the school board to be on this committee. So we are appointed by the Nacogdoches ISD School Board. The majority of the parents, of the members, must be parents. And we do have a good number of parents on the group this year, and I'm really excited about that. The more parent voices that we hear, the better that we can recommend programs for our students. So also, one of the biggest reasons that we want not just parents, of course, but community members and certainly school employees is that we want to ensure that the local community values are reflected in everything that we do through the Student Health Advisory Council. I'm just going to call it SHAC from here on out, or council. So that is really, really important, is we don't want to take any actions that do not reflect what our community values are. We want to ensure that the parents and community stakeholders are able to reinforce knowledge and skills with our children, not just now, but over a lifetime. And we certainly can use everyone's expertise We have people from all areas in the community and parents who can help us reflect values and skills that each of you have in everything that we do with SHAC. One of the things that SHAC can do is we really want to concentrate on the whole school, whole community, whole child method. So everything that we do is not just to represent one child in the school district or one demographic, but really to impact each and every single student that we serve. Obviously, we want to promote school health, and as SHAC members, we can be part of evaluating programs. We can hold programs and policies and things like that accountable, and we can do quality control. These are all areas that we can be involved in. As SHAC members, we cannot implement programs or policies, but our job is to make recommendations. And then the school board takes those recommendations and they make decisions as to whether or not they will be implemented. We have been successful in implementing programs. And so the school board is listening to what we have to say. Mr. Tarvin, can you put up the Senate Bill 9 so we can briefly look over some of the SHAC duties? Okay, so some of you who have been on SHAC previously have seen some of these things. This is Senate Bill number 9, which is going to be a big part of things that we are doing with SHAC this year. But under this bill, the new things are underlined, and we'll go over those. But I just wanted you to see some of the duties of SHAC. And so if you look at that first page, you'll see that we are to recommend the number of hours of instruction hours in physical education. And that's from grade 8 through from kindergarten through high school age, grade 12. We look at policies, procedures, strategies, and curriculum appropriate for specific grade levels, designed to prevent physical health concerns, including obesity, cardiovascular disease, type 2 diabetes, and mental health concerns, including suicide. And we do this through coordination of programs, one of them being health education and mental health education for our students. We look at physical ed and physical activity. As you'll see later, not just in this meeting, we'll introduce it, but in other meetings, we're going to talk about structured versus unstructured play and what part that plays in mental health. We look at nutrition programs with the school district, and we can make recommendations and about any changes or any suggestions that we have. We look at instruction on substance abuse prevention, mental health services. We do have a comprehensive counseling program. We can also discuss any concerns that we have with that. We want to make sure our school is safe and a healthy school environment for all students. And we also look at employee wellness. One of the things that we'll also mention, and we'll work more on and expand on it in future meetings, is human sexuality is going to be a hot topic item based on new mandates that we have by the 87th legislature. So we'll be discussing human sexuality as well. Senate Bill 9 and these notes are going to be posted after this meeting in a few days. And so you can look at these and review them. And if you have any questions or concerns, you can contact Mr. Tarvin or myself with any of those questions or concerns. As we're going along, if you have anything to contribute or you have any questions, please feel free to speak up, raise your hand. We want this to be as even though we're not in person, we want it to be a collaborative thing that we're doing. And you all have, we reached out to you knowing that you have a lot to contribute and we would like you to contribute that. We know that it's a little bit harder when we're on Zoom, but we know that it's definitely possible to have a collaborative event. So as I briefly mentioned, well, we're going to go over goals and objectives for SHAC for this year. And so we'll just leave Senate Bill 9 up, that's okay. But one of the big things that we are asked to do, we're looking at two things mainly this year, and that's Senate Bill 9 and House Bill 1525. Those are the ones that are asking us to do things within the SHAC committee. And so one of those things is recess. And so we are to establish a subcommittee, a physical activity and fitness planning subcommittee. And we must establish that to consider issues relating to student physical activity and fitness and make policy recommendations to increase physical activity and improve fitness among students. So think about it and
That's supposed to be on a Zoom.
I'm sorry. So think about it. If you think that you'd like to volunteer to be on that subcommittee, please let us know either within this meeting or email us afterward. Again, the biggest component of it is we want to make sure that our local community values are reflected in any policy recommendation that we make to the school board. So for the recess subcommittee, we must consider research regarding unstructured and undirected play, academic and social development, and the health benefits for daily recess in making the recommendations. Is there anyone out there that thinks that they might be interested in this subcommittee at this time? Catherine Oliver, I see you. I can't see everyone right now. Let me see. All right, Onella Rust. Did somebody else raise their hand? Tracy Esteb.
Ruby, I was asking if there was a true physical educator on this committee. And if not, I do work with a colleague that would be outstanding in contributing to this action point.
Yes, if you would invite them to our meetings, we can, even though we were selected by the board, we can still, these are open meetings, and we can still invite other people to be informal members. And then if they stay interested, then obviously for next year, we can ask that they be on formally invited to SHAC. But absolutely anyone who can contribute to what we're doing absolutely is invited, please.
Okay, thank you.
Sure. Okay, so that's recess, and let's talk about Senate Bill 9 a little bit more. So this will become effective December 2nd, 2021. And that's what you're looking at on the screen, or part of it. This is relating to public school instruction and materials regarding the prevention of child abuse, family violence, dating violence, and sex trafficking, and the adoption of public school policies to prevent dating violence. This is a pretty big chunk of things that they're asking us to look at. And what they're asking us to do specifically is recommend appropriate grade levels and curriculum for instruction regarding these things: child abuse, family violence, dating violence, and sex trafficking. And then we also need to look at likely warning signs that a child may be at risk for sex trafficking. And we want to make sure that whatever we're recommending does not go against the TEKS, the Texas Education, Texas Essential Knowledge and Skills that the state board develops. And so before we sit down and we start discussing or researching or recommending, the board has to adopt a resolution to convene the SHAC to take this on. And so we're going to wait on the board to tell us, okay, we need you to start working on this. So once the board does that, we start doing our thing. We'll have to hold, once we decide, okay, we think this curriculum looks good, or let's invite this person to look at this curriculum, then we have to hold, if we've decided on a curriculum, we have to hold 2 public meetings on the curriculum materials before we ever adopt anything or recommend for adoption. And then the board has to have a public meeting during a board meeting about it. And the SHAC has to make policy recommendations to the board to increase parental awareness of suicide-related risk factors and warning signs in available community prevention services. So that's an extra component of what they're asking us to do. Now, some of you have been on here on SHAC before, and you might remember Expect Respect. We recommended that to the board, and it was adopted and purchased in November 2020. And I'm going to talk about Expect Respect a little bit later. But Expect Respect does cover every component of these things that they're asking us to do. And so we can, as a council, look at it and decide if we want to re-recommend this to fit Senate Bill 9, or we can look at something different as well. So by no means am I saying, oh, we're already doing this with Expect Respect and we don't need to look at anything else. We're going to do what's in the best interest of our students. Okay, so let's move on to House Bill 1525. That is actually not in this document, but House Bill 1525 became effective on June 16th of this year. And there's a lot of rules about how to run the SHAC meeting. I'm not going to bore you with all the details, but you can look at the notes for specifics. But it's about us posting before our meetings on campuses that we're having SHAC meetings, posting it at central office, and it tells you like how long before the meeting you have to post it. It talks about preparing minutes, making an audio or video recording, which we are doing, and then submitting the minutes and audio recordings to be put on the district website. That's one of the things that 1525 asks us to do. The other thing that House Bill 1525 is asking us to do is to adopt a policy establishing a process for the adoption of curriculum materials for the school district's human sexuality instruction, including instruction in reproductive health. And this is what I was referring to earlier as the hot topic issue. I know we've been discussing this for several years, but now we're actually being mandated to do something, to like put something in place. So the policy that the board is going to adopt must require that the board convenes us as SHAC for the purpose of making recommendations regarding the curriculum materials. And then we have to have 2 public meetings for parents to review materials. SHAC has to provide a recommendation to adopt and that sort of thing. So that's one of the big things that we're going to be discussing and working on this year is looking at human sexuality, looking at curriculum, researching, talking about it. That's why it's great that we have so many new members, because it kind of mixes up some of us that have been here before, and we want to recommend something to the board that we all feel truly reflects our community values when it comes to human sexuality.
Ruby, if you don't mind,
Uh-huh.
for all you out there, this is something new that has been mandated on a school board. And so they have to go through a process of doing this. And so we are expecting for, and this is just an expectation, but January is when we believe the board will adopt this and ask us to start looking into this process. That does not mean that we cannot go ahead and start doing some research and looking at some things, but we expect it to really hit us in January.
Okay, thank you, Mr. Tarvin. Do we have any questions or concerns so far? Okay. So the next item is our meeting dates. We did, I believe, put those on our invite, but just to let you know for planning purposes, our meeting today, we have December 7th, February 8th, and April 12th. Now, if we need to, we can certainly add meetings, especially given that we're going to be working on so much. We can definitely add meetings to that, but these are the formal dates that we will be meeting.
Yeah, and we're gonna have to add some because we have to have some open public meetings on all of this as well. So as a team, we'll get together and we can make some decisions on when we're going to do this.
There was a question in the chat if these meetings would be all virtual or we would have in-person meetings.
Yeah, I saw that, and I was going to talk to the group at the end of the meeting and see what they wanted to do. We certainly want everybody to be comfortable, but we also face-to-face meetings, in my opinion, are the best way to conduct business. We get more done, we get more collaboration, and I would certainly like to see that, but I want to make sure that the group feels secure in that. Okay.
I have my school board meetings on the second Tuesday of every month. So this December 7th, February 8th, and April 12th, my Christ Episcopal school board meetings are from 6 to 7. So I can come in early and then rejoin. I could try to reschedule my board meetings, but they've been on the second Tuesday of the month for years and years.
All right, for those of you on tonight, if you don't mind putting in the chat session whether you prefer face-to-face or you'd like to stay with the Zoom type meetings. If y'all just put it in there, I'll count up how everybody feels and we can go from there.
Okay, so I'm going to hand it over to Kelly Poole, who's going to give us some school health updates. She'll tell us about COVID-19 and then vision and hearing screenings. Kelly, are you on? Yeah, she's on. Mr. Tarvin, can she unmute herself?
I'm sorry, what was that?
Can Kelly unmute herself? I'm not sure if she's
Yes,
having an
She
issue with
has the
that.
ability.
Okay, so let's jump over to expect respect updates, and then Kelly can come back and give us some school health updates. So expect respect is a program for the prevention and intervention. It's an intervention program to break the cycle of abuse and prevent violence from happening in the first place. And this was recommended by SHAC in response to mandates of the 86th legislature, and it was approved by the board and adopted November 2020. So we have started utilizing Expect Respect in the school district, and I think started last year and then this school year also. And so we're still, in the beginning stages on some campuses, in the planning phase on some campuses, but then other campuses have been rolling with it. So there's 3 components to Expect Respect, and one of them is support groups and counseling, and this is for students grades 3rd through 12th. And it's for students who have experienced any form of violence or abuse. They have witnessed violence at home or among family members. They are involved in unhealthy or abusive peer or dating relationships. They have difficulty managing anger or frequently get into fights. They are involved in bullying or sexual harassment. They are pregnant or parenting. Or they are socially isolated or lack skills for developing positive peer relationships. This is done this is not for all students, it's groups. So they are hand selected, hand picked, either recommendations from counselors, teachers, or the social workers have been working with these students. And they have to be assessed for group appropriateness. And so they have these groups that are weekly, once a week, and they are for elementary kiddos. I think it's 14 sessions. Lauren is experienced with this, and so she might jump in. And then for high school for secondary students, middle and high school, it's 24 sessions, I believe. The second component is a youth leadership development program, and that's for students 6th through 12th. And it engages youth as leaders in creating safer schools and communities through youth-led prevention programs. And so this can take on a number of different projects and ways in which they might do that. It's student-led. So it really just depends on what the students want to do with the lessons and their creativity. It can be a poetry project. It can be a theater production. It can be a group and a poster contest or something like that. But some of the topics that go with it are building community. So you're teaching them how to be leaders, exploring identity, status, and privilege, mapping gender. And when I'm talking about gender, I'm talking about stereotypes, men don't cry, women stay home. We are challenging those stereotypes. Standing by or standing up is a bully prevention program. Loving or hurtful romantic relationships. We're teaching about boundaries and consent, and not falling, not being a victim and what a victim is, and preventing that violence from ever happening. We're looking at confronting the continuum of sexual violence. So what is sexual violence, and how do we prevent that? And what do we do about it if we have been victims? And then the journey to activism. So we're teaching them again how to be school leaders within, or how to be leaders within their campus and also their community. And then the third component is school-wide strategies, and that's for grades 6 through 12. And it's about creating safe and supportive school environments. It enlists the help of adults to respond to and prevent serious incidents of violence. So we're teaching adults, we're asking them to be positive role models in students' lives so that they know what it looks like to be in healthy relationships with youth and with adults. We're educating the universal population of students and families. We're facilitating access to services for vulnerable youth. We're looking at strategies and tools to engage schools, parents, and community organizations in creating safer and more welcoming environments for youth. So this whole program is in response to the 86th legislature mandating that we look at safe and healthy schools. As far as implementation this school year, we are lucky in that we have new social workers, and so we've expanded the social work program. And by the same token, that means that we're learning and we're mentoring. And so some of our social workers are new to this program and are just now learning what the program is about, are learning what their student population looks like, what their caseloads look like, and how they may be able to implement that. I'll give you a quick rundown. Brooks Quinn Jones is selecting students for groups presently, and they're sending out consent forms. Carpenter is utilizing the program with 3rd through 5th graders this school year. Fredonia is implementing it with 5th graders. So she's laying out the groundwork for the groups this semester, and then really kicking it off in the spring semester. Reggae is looking at utilizing it in the spring semester. TJR is identifying students who would benefit from groups, from the group component of the program. Mike Moses is looking at utilizing it with 6th graders. And the rest of us are either planning or familiarizing ourselves with the program for implementation in the future. Any questions about that program? Kelly, are you with us?
Ruby, let me expand just a little bit on the additional social workers for those of you who don't know.
I'm like nervous being
We have this
grant
money from the federal and state government that allowed us to, it's designed to bridge the gap in learning loss for the kids due to COVID, but it also allows us to work on the social and emotional learning side of it. So the district wanted to expand social workers in the district. And so we now have a social worker on every campus, okay, through this grant money. We're going to have this grant money for at least 3 years, so we have them during this time. But the other thing that the district did was we not only do we want to take care of kids, but we want to take care of staff. And so we have contracted with Miss Asia to help with our staff. You know, they're going through an awful lot. They have their backpacks full at home with COVID. Then they come back and they're visiting with all of our kids who are having issues and lots of learning gaps and lots of things put on them. And they really needed an outlet at times. So Miss Asia is taking care of that. So I think we're headed in the right direction with our SELs, and I'm looking forward to seeing how this proceeds.
Kelly Poole, are you ready to go over some school health updates?
Yes, I can. Can you hear me?
Yes, thank you.
Okay, I'm sorry. I'm leaving Carpenter. I'm doing COVID vaccine clinic for kids. So I'll get started
Yeah.
with that. We started our first COVID clinic for today. We ended up giving 56 total vaccines, but some of those were adult boosters of Moderna and Pfizer, as well as the kids. We just left, so I didn't have time to calculate those numbers. We'll be at Reggae on Thursday. We already have 57 people signed up for that. And then we'll be hitting the rest of the elementary campuses next Monday and Tuesday. We've had a great turnout, more than we expected. Our COVID numbers in the schools are very low. We've had very few cases in the past month. We have completed all of our vision and hearing screenings for all of the state mandated grade levels. We will be doing rescreens one day this week and one day next week at the middle schools, and then we will be done for that.
Thank you, Kelly.
No problem. Also, I forgot to add, we did hire 2 float nurses where we have been able to testing staff before the school day or work day, and they are housed over at Margie Chumley. And then they are utilized throughout the district wherever we need them during the day. And it's been a great help to have them as well.
Thank you. So we also need a parent co-chair for our Student Health Advisory Council. So one of the things that's mandated is that we have a staff member helping coordinate, facilitate the meetings, but then that we also have a parent co-chair who can help with the meetings and with different things with SHAC.
Ruby, we did have one parent email, Miss Katie Trotty, who said she would be willing to be a co-chair.
Okay.
And she's done this before. Hi.
Hi. So I will say I've done it, but I've never been asked to do anything. So I'm happy to do it, but I don't know if I'm supposed to have a job. You're
Well,
going to have to retrain me because I just really had the title, to be honest.
Well, it is meant so that you're my other half. I don't exactly know. Of course, I'm new to facilitating the SHAC as well. And so we're just going to have to learn together.
Well, I'm happy to do that. I'm also happy to relinquish that if someone else wants to take it. So whatever works best for the committee is fine with me.
Okay.
so do we have any volunteers? Okay, so
Looks like it's you, Katie.
All right. Thanks.
All right. So now we're going to welcome Tracy Esteb, who's going to talk to us about programs that she's got going on that that are beneficial not just to the school but our community as well.
Thank you. Can I share my screen?
give me 1 second and I will take care of that. You are now the host. So yes, ma'am, you should be able to do it now.
Oh, presentation. Be sure I have the right one. Can everyone see my screen?
Yes.
Yes, ma'am.
Okay, wonderful. Well, thank you, everyone. My name is Tracy Esteb, and I was on the Shack last year. It was my first year, so I'm very happy to be back. And it's so exciting to see so many people at a meeting. So there's lots of familiar faces and new faces. So I'm really excited about that. So I am the Better Living for Texans Extension Agent for Nacogdoches County. So I'm going to start off and just give you a brief overview of what Agrilife is, because only 30% of Texans know who we are and what we do. And then I will go into what specifically Better Living for Texans is. So the Texas A&M Agrilife Extension Service is a unique education agency with a statewide network of professional educators, trained volunteers, and county offices. It reaches into every Texas county to address local priority needs. Some of our major efforts are in mitigating drought impacts, conserving water use in homes, landscapes and production agriculture, improving emergency management, enhancing food security, and protecting human health through education about diet, exercise, and disease prevention and management. Agrilife Extension demonstrates the latest technology and best practices to improve the state's food and fiber system, which serves all Texas consumers and contributes 9% of the gross domestic product. Texas 4-H, our primary youth program, engages roughly 600,000 youth every year in learning projects, leadership development, and community service. So collaborative programs enable us and our partners to extend resources and prevent duplication of services. And in total, extension personnel and extension trade volunteers achieved nearly 23 million direct teaching contacts, including distance education through the web in 1 year. So we're trying to reach more. So essentially, our mission is serving all of Texans and improving the lives of all Texans. So we are a vast network. We do cover the entire state. We have offices in 250 of the 254 counties in the state of Texas. However, those 4 other counties are still representative. We have a couple of agents that double up on counties. And we're collectively, between our specialists and our agents at the counties, make up 900 professional educators, all with different expertise areas within Agrilife. And we're available for every Texan. So as long as you live in the state, you can call us and we're going to help you. So I mentioned that all of our personnel, they expertise in some area. So our program areas fit in these 5 categories of protecting our environment, enriching our youth, improving our health, growing our economy, and nourishing our world. Agrilife does everything. It's amazing. If you ever get a chance to visit our website, I mean, we're helping people with cattle and goats. We're doing youth programs with 4-H and our other parts under our umbrella, beekeeping, farming. I mean, just it's an amazing organization. So for Nacogdoches County, we have 3 agents right now. I did not include the little logo or anything for our agricultural and natural resource agent because we are just focusing on the health and family side right now. So I am the Better Living for Texans agent, and we have a new family and community health agent that just started this summer. So we're excited to have her on board. Our differences is really through our funding. So our family and community health agent, which is an FCH agent for short, she is a county employee. So her funding comes from the county and from the state. Whereas for Better Living for Texans, which we call BLT for short, we operate off of a federal grant. So I am not a county employee, but the county does house my office. And all of my funding is through a federal grant. So what specifically, I'm just going to now, I'm going through the umbrella and getting down to just BLT. So what BLT does, we provide evidence-based research for free to individuals, families, and the community at large. So we provide nutrition, health, and wellness programs. And I really highlighted that evidence-based research because it's critical. It's evidence-based. So you have the 3 levels of research, the knowledge, and then research and evidence-based. So with the evidence-based, you get the effectiveness from the research, but the evidence, then you have the efficacy of it as well. So all of our programs have gone through pilot programs, extensive research, and all have that backing as well. So the BLT target audience, we do adult and youth. And the general guideline is for individuals or families who are SNAP participants or would be SNAP eligible. We have so many people in the county who are SNAP eligible, but do not apply or utilize that benefit. So we can reach that audience in other ways. So it's more kind of defined as a limited resource audience. So these are going to be families that are involved with Head Start, WIC, SSI, food pantries, businesses. So like, let's say, for example, Dr. Furness wants to have a nutrition education program for some select patients. As long as at least 50% of the audience that he chooses for that falls in that income requirement, then we are good to go and go with it. And the great thing about this too is the Title I schools. So all of our public schools in the county are all Title I. So we are available to go into all of the schools, and especially all of them for NAC ISD as well. So our funding, as I said, it was through a federal grant, so that our funding comes from the USDA Food and Nutrition Service, and specifically their Nutrition Education and Obesity Prevention Grant. We have received this grant for over 20 years now, so it is not, hopefully, job security, going anywhere. So we are here. So the money comes from USDA through the grant, and it funnels into Texas Health and Human Services, and then they send it on to Agrilife for the specific program. And we're pretty excited. Our budget got increased this year, so we got awarded $8 million this year. So with it being a federal grant for Better Living for Texans, there are only 5 specific areas that I can do programs for. And if it doesn't fall into one of these areas, we have our FCH agent here to cover those gaps. So the focus area is increasing fruit and vegetable intake, and included with that is also going to be like, what is My Plate, how to utilize My Plate, how to read a nutrition label, things of that nature fall under that as well. We have our food resource management, which is going to be how to save money at the grocery store, food safety, improving access to fruits and vegetables. That's going to be gardening programs. So putting in community gardens of that nature to improve access and increase physical activity. So these are our adult programs that I can do. The ones that are notated with a caret in the front of it are going to be the nutrition education based programs. The one with the leaf, that is our gardening program, the adult gardening program. And then the one with the shoe is our physical activity programs. So in a school setting, these programs could be done for either employees or parents. So either way, so employee wellness or community outreach or parent-family involvement. And these are my youth programs, and same notations with the carrot and the leaf and the shoe. We are really excited because USDA just approved for our new program, which is this early childhood Learn, Grow, Eat, Go. So I'm in the process of getting the curriculum for that one right now, but we have gotten the go ahead to start that program during the spring semester. So that's really exciting because this Learn, Grow, Eat, and Go is our most popular youth program. So for Nacogdoches, during this is fall, spring semester, I did do Color Me Healthy at Fredonia Elementary. So we did it for 2 pre-K classes, and we weren't allowed in the school, of course, because COVID, but we, the teacher and I, we've got it down. So I would deliver all of the supplies that she needed for the lesson to the school, drop it at the front door, and then they would get it to her. We just started a rotation with all the supplies. With this particular program, it can be for pre-K or kindergarten students. And every week they get to taste different fruits and vegetables. They ended up tasting, it was over 20 different fruits and vegetables by the end of the program. And of course, with all of our programs, we want to document and know what those behavior change outcomes are. So they did do post surveys, the parents did, and the teacher. So this one was just exciting. Well, first of all, I got 75% of the surveys back, which is remarkable. But just, I won't read the whole thing, but 83% of the parents reported improvement in willingness to taste vegetables. 94% saw increase in physical activity. And the parents also got weekly newsletters that had recipes also. So 94% of the parents had used those recipes as well. And over half said that they had seen other positive changes regarding healthy eating and physical activity. The feedback on the program was great. I have met with the new director of pre-K and talked to him about this program. So we are hoping that in the spring semester, we will have some of the classes that will do that program. We did the Learn, Grow, Eat, and Go for Cushing Elementary School last spring. And I am so excited because Carpenter Elementary is doing it in the spring. So I'm still waiting to find out how many classrooms are going to be doing that. That program is designed specifically for 3rd grade, but it can be used for 2nd through 5th grade. So just waiting on that paperwork to find out how many, and hopefully we will be able to expand to the other campuses going forward after that. I've been working with Dr. Corley on this. So she had approved this curriculum. So just a really quick plug too, we have an adult program that is starting. I'm partnered with Brown Family Health Center. So we have an adult gardening program. I know it's getting late, but we are going to try our hand at winter gardening. So if you know anyone that's interested in that. My SCH agent also has this program that is starting next week. We received an additional grant for this region of Texas from the Temple Foundation. So she is going to be able to provide some free groceries for live cooking demonstrations that are going to be going on. It's all complete virtual program. It's done with Polk, Trinity, Angelina, and Shelby County and Nacogdoches. And we really wanted to target families with children in schools here. So if anyone is interested in more information for this, just call our office, email me, anything. We'll be happy to help you get signed up for that, or if you know any parents that would like to participate. And that is coming across because the grant from the Temple Foundation, we've been trying to ignore the program guideline dates because of COVID. It got extended. So this is actually going through December 31st of this year. But if we can get more schools to participate, or that will start in the spring, we will have that funding covered as well, but we need to know very quickly. So with this grant, we are doing healthy school recognized campuses, where if they do right here, a school-wide walk across Texas program, which is our physical activity program, and they do one youth program like the Learn, Grow, Eat, and Go that we're doing at Carpenter. I also got special approval to include the Color Me Healthy that we did at Fredonia on this also. But unfortunately, they are not going to participate in this right now, but hopefully we're going to get the grant again in the future. And then one program for adults, then you can be recognized as a healthy school campus. It gives schools bragging rights. We have big banners that they can put up in front of the school, and we have proclamations made at the school board meeting and commissioners court also. So that's just something to keep in mind. COVID really messed up this program. So hopefully we will be able to apply and get this grant again in the future, because it's been amazing. So here is all my contact information. So if anyone has any questions or wants to learn any more about our programs, feel free to contact us. We are happy to come out and talk more about any of the programs that we have. I think that's it. Does anyone have any questions or anything? I know Dr. Furness is now ready to do a program.
Thank you, Tracy.
Well, thank you, Ruby.
I would love to do a program, actually. It sounds great. Thank you.
Well,
That's
great.
awesome.
Call me.
Okay.
Oh, I should add also, in our network of specialists that we have with Agrilife Extension, we have several that specialize in shacks too. So moving forward, if we have any difficulties or questions or anything, we can utilize our resources as well to help.
Perfect. Thank you. Well, that's all that's on our agenda. Does anybody have questions, concerns, comments?
I will tell you all that through your responses on the chat, most of you said either way we can go. We really only had one that just came out and said Zoom, and then we had 4 or 5 that said face-to-face. One of the things that I need to look at, because a couple asked about a hybrid where some people could Zoom in and some people could be face-to-face. This committee now has to be either video or audio and then put up on the internet through our system. I will have to figure out how we can do that with a hybrid situation. So I will work on that, and when I send out the calendar for the next meeting in December, I will have some information that goes along with that. We'll try to figure out. I'm telling you, I think we need to do a face-to-face, and so I think that's what we'll plan on. I just got to figure out how to incorporate the Zoom and audio and video recordings. Does anybody have anything else?
Roya Dembale is talking about we can set up some camera of some sort. But yeah, we've got technology people that can help us out.
Yeah, oh yeah, and we'll be looking at it. Well, folks, I really, truly want to say thank you all for being a part of this and spending your time with us. This is going to be a very busy group. There's going to be quite a bit of research done throughout the year, and we certainly appreciate it. And Ruby and I are here to answer any questions or concerns that you guys may have. And thank you all. Ruby?
Our next meeting is December 7th, and we'll let you all know ahead of time if we're doing a Zoom, hybrid, or face-to-face. And it's now 6:31, and we'll adjourn the meeting.
Thank you all.
Thank you all very much.